Many of you know that there's a national shortage of BCG, and many of you know that there's a brand new code put out by CMS when it comes to BCG Billing. We are going to talk about that in this video right now. Hello, my name is John Lin. I'm a urologist in Gilbert, Arizona, also your host of the Thriving Urology Practice Facebook group, where we come together and help each other so we can thrive and survive in this crazy healthcare delivery environment. All right, let's get right into it. There's a national, if not an international, shortage of this little drug called BCG, given to patients with certain types of bladder cancer. Now, Merck, the only manufacturer of BCG, is at max production, meaning they can't crank out any more. Unfortunately, that leaves us with a shortage nationally when it comes to being able to obtain this drug and delivering it to the patients who need it. A lot of societies and associations have talked about how to administer it and maybe alternatives and things like that. Unfortunately, no one talks about how exactly do you use the new J9030 code when it comes to billing for BCG. Now, let's assume that you have a patient and you are fortunate enough to have a full dose of Dose BCG. If you deliver that dose to the patient, you would use J9030, which means intravesical BCG live 1 milligram. Normally, Dose BCG is 50 milligrams by wet weight. If you deliver that full dose BCG to the patient, you would bill J9030 50 units to designate 50 milligrams delivered to the patient. Now, if you have that same patient and you use that BCG, deliver that BCG, not completely, but you give the patient half dose and you discard the rest, you would bill J9030 quantity 25 because you only delivered half of the dose, and then you would use the JW modifier, the Hicks-Picks-2 modifier, to tell CMS that you discarded the rest. Now, that would be a waste, right? You have a full dose BCG that you only gave half dose to one patient, and you threw away the other half. Now, what about partial dosing? What about giving the patient half of a dose and then you give the other half to another patient that needs it? Believe it or not, it is kosher by CMS for you to perform split dosing and bill for partial amount. We've known about that, and that's part of the reason why J9030 came about, to make it easier for us to do partial dosing. However, there are some caveats before you can do that. Number one, you need to have the appropriate infrastructure to split that dose to make sure that your personnel is protected when you split that dose that is usually designed to be given to one patient. Secondly, your state must allow you to split dose the medication when it's designed for a single dose. Lastly, your Medicare administrative contractor and or your private payer, if you're delivering this medication to a private payer, has to allow you to bill for a partial dose of this medication. So those are the caveats that you need to consider when you are thinking about delivering partial dose. Obviously, partial dosing, you would just bill the exact milligram amount that you deliver to the patient if you have the infrastructure, if your state allows it, and if your payer allows partial dosing. I want to give credit to Mark Painter, whom I consulted before I came on live to deliver this video message. And if you're interested about learning more regarding coding, billing, or how to run your practice better, PRS Network, to which Mark is a part, and they have a semi-annual coding course called the Urology Advanced Coding and Reimbursement Seminar. I will put the link in the video description below. They are hosting one in December, and I believe they usually host another one in February of next year. So look into it if you're interested. In addition, the American Urologic Association has their annual coding seminar, usually held in Las Vegas, The one that is coming up in 2019 is in Las Vegas on July 19th and 20th. So look into that. I will also put the link in the video description. Any comments, questions, please leave them below. Thank you for watching this live stream. Take care.